Okay, everyone, so it's 1:05, so we will get started if Kylie and Kathleen are ready. Good.
Yep.
Thank you to everyone for logging on to Breastfeeding Grand Rounds today as we celebrate World Breastfeeding Week at the IWK and beyond. World Breastfeeding Week is held every year around the world to celebrate, inform, engage, and invigorate passion around breastfeeding and related issues publicly and politically. This year at IWK Health and Nova Scotia Health, we are highlighting the experience of breastfeeding throughout a global pandemic. Today, we're very fortunate to have Dr. Kylie Whitfield and Kathleen Chan with us. Dr. Whitfield is an assistant professor in applied human nutrition at Mount St. Vincent University, and she runs the milk and macronutrient lab at the Mount. She and her team of student researchers focus on nutrition for the first 1,000 days from conception to 2 years of age. Her current research centers on improving nutrition for Cambodian babies and helping breastfeeding mothers in Nova Scotia to successfully meet Health Canada guidelines. Kathleen Chan is a master's student in the Applied Human Nutrition program at Mount St. Vincent, and she's currently completing her clinical dietetic internship at the IWK. She's been part of the Milk and Macronutrient Lab at the Mount since 2017. Her research has also focused on infant and young child feeding knowledge and attitudes, as well as thiamine deficiency among lactating women in Cambodia, under the supervision of Dr. Whitfield. So welcome to both of you. Thank you so much for being here. One thing I just wanted to mention before we get started, if any of the attendees have a question, please post it in the bottom right-hand screen corner of your screen where it says chat. And there should be a drop-down menu where you choose everyone, and then everyone can see your question. And then we'll get Kylie and Kathleen to answer those questions at the end of their presentation. And I'm going to hand it over to Kylie now to take it over.
Perfect. Okay, well, thank you first and foremost for the invite. It's always exciting to have a captive audience, especially during World Breastfeeding Week. It really fits in well. So thank you for having me. So I thought that I would just kind of mention a bit about myself. Why am I here speaking right now? So I run the Mama Lab at the Mount, and about half of my research life is here in Nova Scotia, where I'm trying to understand responsive feeding, and we're focusing on human milk being fed directly at the breast, but also from a bottle, and what that means for caregivers and for health outcomes of infants. But I also spend half of my research life in low and middle income countries. So we've got projects right now in Bangladesh and a big project in Cambodia where beriberi is still prevalent. And so this is kind of how I see breastfeeding and see the world, just for a bit of context. And importantly, in the last few months, we've done a bit of COVID research, which I'm excited to share some preliminary results with you. So it is World Breastfeeding Week, and I have a sneaking suspicion that the theme for this year's World Breastfeeding Week was set before the pandemic. This year's theme is For a Healthier Planet, which I think was targeting towards the environmental impacts of infant and young child feeding, but I think is still very fitting considering the world that we're living in right now in this COVID pandemic. So that's the theme for this week. So in that sense, we're going to start off today. I'm going to give a bit of some background around COVID and human milk and potential vertical transmission. Then I'm going to move to speak to some research that we've done here in Nova Scotia during the state of emergency. And then I'm going to pass the mic over to my very recently graduated master's student, Kathleen, who's going to speak to some research more generally about infant and young child feeding here in Nova Scotia. So COVID-19 probably needs no introduction. For those of you listening to the news this morning, you heard that over last night, we reached 1 million deaths from COVID around the globe. So I don't think I need to say much, except to remind you that it was only a few short months ago that we really didn't understand much about the transmission pathway of this virus. So pretty early on, we learned that it could be spread through respiratory droplets, but a big question that was in the forefront of probably all of our minds was around the vertical transmission of COVID-19 from mums to babies. And the WHO and many other international health organizations were trying to figure out and weigh the balance between exposure to COVID-19 for the infant and not breastfeeding, which has huge potential consequences. So we know, for example, if we tell mothers not to breastfeed, we're going to lose that early skin-to-skin and prolonged skin-to-skin, which can have impacts on things like thermoregulation and blood glucose control, among many, many others. But we're also then not providing the infant with human milk, which can have a huge impact on exposure to the numerous bioactives that are present in human milk. So I've got some of them listed here: cytokines, lactoferrin, oligosaccharides, and importantly, secretory immunoglobulins that can help with the development of the immune system in the infant and help to protect against respiratory and GI tract infections. So the big question early in the pandemic was, allow breastfeeding, encourage breastfeeding, but what's going to happen with those COVID-19 transmission rates? And I think a lot of people immediately thought back to the HIV epidemic and the early days when in the 1980s, we were trying to, the royal we, were trying to figure out how HIV was transmitted. And we know that there's a vertical transmission from mom to babe between 10 and 20% when the mom is not on antiretroviral therapy. Early in this pandemic, we knew that human coronaviruses are capable of being transmitted vertically from mom to babe. One of the 4 common human coronavirus strains, the strain 229E, does undergo vertical transmission. So that was a concern with the novel coronavirus. And importantly, we had the kind of biological feasibility, the plausibility that COVID-19 could be transmitted vertically. Because we know that when moms are sick, when they're in a state of inflammation, we see leaky tight junctions and things like viruses can pass through into the milk. And so that's the concern from the milk side. But we also know that with respiratory droplets, there's also potential for contamination through other means. So close contact between mom and babe when breastfeeding, but also potential contamination with the virus on the skin, on pumps, baby bottles, all sorts of different ways. So there's the concern not only about the transmission in the milk itself, but also through the close contact. So I have to start with the punchline because you're all in a health center and you clearly know the recommendations. So the latest WHO recommendations are that mothers with either suspected or confirmed COVID-19 should be encouraged to initiate and or continue to breastfeed. And moms should be counseled that the benefits of breastfeeding substantially outweigh the potential risk of COVID-19 transmission. So this is the WHO statement, but this has been echoed in numerous organizations. So for example, UNICEF follows that same WHO recommendation, but they have a bit more pragmatic advice with their what they call the 3 Ws: wear a mask when you're feeding, wash your hands before and after touching the baby, and wipe and disinfect the surfaces regularly. So it's the same recommendation, and we also see this in Canada. So the Public Health Agency of Canada, again, is giving that same recommendation, the same 3 Ws, and they're giving a bit more contextual advice. So for example, they specifically say to disinfect things that are relevant in our world. So things like nursing pillows and breast pumps. The only difference here is that PHAC is also recommending that mom and babe not leave the home unless medically indicated. So that's a bit of a difference. But in general, we're seeing the same echoes of these recommendations. So where do the recommendations come from? What evidence is being drawn upon? Well, there's been a number of studies that have come out from case reports and case studies over the past few months. And I thought that I would just go through quickly and kind of give an update on what's known to date in human milk. So this is a systematic review that was conducted up until April 17th. So this was still early days in the pandemic, and it was based on 13 studies collecting 48 milk samples from 32 moms. So here is the table showing all of the results, but I just want to highlight a few things. This first row here highlighted in yellow shows the location of these studies. So again, this was early days, the search up until April 17th. So nearly all of these data are coming from China, with 1 study in Singapore and 1 in Italy. And the other thing that I want to draw your attention to here is the very last column that says infant breastfed. And for all of these highlighted in yellow, either the feeding source of that infant isn't known or the baby was not breastfed. And this is just to remind you that early days, there was a lot of mother-infant separation taking place just because we didn't know. And so in most of these cases, these milk samples were collected from moms for research purposes, but that milk was never actually fed to the infant. So of these 48 milk samples, 1 single sample, shown here with this first yellow box, was tested positive for viral RNA particles. So not the live virus, but some evidence of the virus in the milk. One of these 48 samples, interestingly also, one of these 48 samples, a different sample, tested positive for COVID-19 specific antibodies, which is exciting. And I'm going to speak to this a little bit in a few minutes, that there is some evidence of potential passive immunity potential through human milk. So based on this systematic review, there's not tons of evidence that COVID-19 is being vertically transmitted into the milk. The second study was put out in JAMA just a few weeks ago. This is an American study. So they collected data between March 27th and May 6th. So still, again, pretty early days. They had 64 milk samples from 18 American women with confirmed COVID-19. And these were mums to babies between newborns up to 19 months. Of these 64 samples, one sample tested positive for RNA particles. But what's really interesting about this is that this mother had submitted a number of samples from her freezer before she was symptomatic with COVID-19 and afterwards. And only one of her milk samples was positive, and that was the milk sample that was collected on the day of symptom onset. So what's interesting about this is that the milk samples for this study were collected in mums' homes and mailed into the lab. And so there's big potential here that RNA particle is not actually from the milk itself, but from contamination from her environment. But B, that maybe there's something about peak viral shedding, which we think is happening around that time, that there could be higher risk for viral transmission into the milk in the early days of symptoms. But again, that's just a bit, it's still to be determined. But anyways, just a little bit interesting on that study. The World Health Organization is not using either of those two systematic reviews at this moment to inform their recommendation. Instead, they're pulling from two major sources. The first is a systematic review, which I'm showing right here. They're calling this a living systematic review because it's being updated periodically. And so this systematic review was last updated on July 7th. It is pulling data from using 46 breast milk samples. All of those 46 mums tested positive for COVID-19, and 13 of their infants were positive. Of these 46 milk samples, 3 of them were positive for viral DNA particles. But again, interestingly, only one of these infants who would have been consuming this milk actually tested positive for COVID-19. So again, we don't know if that RNA is coming from the milk itself or from contamination from the environment. The second major paper that's being used to inform the WHO evidence is a preprint. So this was a preliminary report. It was published online in early May. This is research out of Mount Sinai Hospital in New York. And importantly, this study has not been peer-reviewed yet. So just wanted to mention that. 12 of the 15 milk samples in this preliminary study contain secretory IgA, so these COVID-19 specific antibodies. So that's a much higher proportion than what we saw in the Lackey systematic review. But again, some evidence of potential passive immunity. So overall, what we're seeing, very few milk samples are containing the viral RNA particles. And if they do, we don't really know if they're coming from the milk themselves or from potential contamination during milk collection. Seemingly, there's more evidence of a secretory IgA dominant COVID-19 immune response in human milk of mums who have tested positive for COVID-19. And this could be really important for passive immunity. So of course, this is a very hot area of research right now, and there's many studies that are ongoing. I can see it in the different lactation societies that I'm part of. I can see that people are collecting samples. So I think we need to keep our finger on the pulse of this, but right now it seems like probably there's limited evidence for vertical transmission and probably more opportunity for passive immunity in the case of the novel coronavirus. So all of this comes together, of course, with the WHO recommendation that internationally we're recommending that mums initiate and continue breastfeeding because of the risk. We know that globally, when we look at the risk of mortality, it's 14-fold higher among kids who aren't breastfed. So I think that's why the WHO is moving forward with this. So the only other thing that I'd like to mention specific to kind of lactation in COVID-19 is that it's really important not to forget about human donor milk. And so again, taking that historic perspective, even if you weren't around in the 1980s, you'll remember the important role that HIV played in the human milk bank scene in Canada. HIV and risk and concern around vertical transmission essentially shut down almost all of the human milk banks in Canada in the 1980s. And so it's really important to try and get a hold of this and understand if COVID can be inactivated through Holder pasteurization, because otherwise we're at a real risk of this history kind of repeating itself and seeing a shift back away from our human milk banks in Canada, which would be a real shame because we know that pasteurized donor human milk is the standard of care for very low birth weight infants, including at the IWK. So we know right now that in Himbana-affiliated milk banks, donor moms are being screened verbally for the symptoms of COVID-19, but they themselves are not actually being swabbed for COVID-19, and their milk that they're donating is not being assessed using for viral RNA particles. And so it's important to understand whether or not, if there's COVID in that milk, is it going to be inactivated? So thankfully, the answer is yes. So this study is out of the Roger Hickson Milk Bank in Toronto. So here, the various samples that are shown in the table were donor samples collected from moms donating to that milk bank. All of these samples were spiked with COVID-19, and then they underwent Holder pasteurization, which is 62.5 degrees Celsius for 30 minutes. And as you can see in this yellow box, all of these samples had undetectable COVID-19 after the Holder pasteurization, which is terrific news. What was also interesting, though, is that they had a control sample where they had spiked this milk sample and left it on the counter at room temperature for 30 minutes, and they saw a threefold decrease in the amount of COVID-19 in that sample that didn't undergo Holder pasteurization, which is just kind of interesting because you can see that those bioactives in the human milk are doing what we would hope they would do and inactivating some of that COVID-19 in the milk sample itself. So long story short, very good news. We can still use pasteurized donor milk samples with confidence. Okay, so switching gears a little bit to COVID-19 as the emergency, we know that in emergency situations, breastfeeding is recommended, and this is for various reasons. One, clearly the milk bioactives are protective against various pathogenic infections during any emergency situation and in real life. But we also know that the provision of human milk will help to meet the nutrition and hydration needs of infants. That's essential during the exclusive breastfeeding period, but we know that even after that, for the first 2 years and beyond, that in these emergencies, human milk can make up a large portion and meet a big chunk of those nutrition and hydration needs. And then, of course, also playing at the same time, the code helps to protect against the unsolicited donation of human milk substitutes. So really, we're all pushing for human milk feeding in emergency situations. But if we look for evidence, most of emergency feeding research is done either with natural disasters, so the fires in Fort McMurray or tsunami in Japan or Hurricane Katrina, things like that. And these tend to be shorter term emergencies. Or research is done in conflict settings, which tend to be prolonged, but normally we're seeing overcrowding instead of isolation. And so when the COVID-19 pandemic and the state of emergency started, we didn't really have great examples to look to try and understand how best to support new parents, new caregivers with young infants. And so because of that, my lab decided to run a study here in Nova Scotia just to talk to caregivers of infants under 6 months living in the province to try and understand what they were going through, what they needed, what they knew, and what they didn't know. So the objective of this study was really wide open. We were just trying to gain an understanding of whether and how caregivers of infants under 6 months perceive changes to infant feeding and any other food or health-related matters during the COVID-19 state of emergency. So we did this through an online questionnaire that was available across the province. We started data collection 4 weeks after the state of emergency started in Nova Scotia. So we collected data starting on April 17th. And we collected data for 4 weeks on a rolling basis, leading us out to May 15th. And at the end of the day, we had usable data from 335 caregivers across the province. So I'm going to share some preliminary results with you right now. So we're still analyzing and writing up. So the huge majority of participants in this study were female, and they were mothers of the infant. But remember, we were asking for any primary caregiver of the infant to fill this survey. The mums were on average 31 years old, and the majority were breastfeeding. So 60% of the respondents were exclusively breastfeeding. And the large proportion of respondents were white and either married or in a common law relationship. The babies were half and half boys and girls, and on average were 16 weeks old, but we had a good range there from babes as young as 4 weeks up to 24 weeks. And the households, 71% of the households in the study were above the median household income of $60,000 a year in Nova Scotia. 3/4 of caregivers were receiving EI parental leave benefits before COVID-19 happened. And about 60% of respondents were living in the central zone, but we did have representation from all 4 zones in the province. So I'm going to start with COVID information seeking. So to start, essentially everyone was looking for information or was accessing information about COVID-19 at this time point. Interestingly, we didn't see any differences by caregiver age, educational attainment, or household income. That's essentially because everyone was looking for information. And not surprisingly, when we asked for the main sources of COVID-19 information, most people were using the internet or social media or some mix of both. Lots of caregivers specifically referenced popular blogs like Kelly Mom, whereas others would say that they were looking to mom and baby groups on Facebook, groups like La Leche League, or they were seeing traditional media being posted on social media, so links to CBC articles. But also a big chunk of our respondents said that they were just passively receiving information from whatever their friends posted. Now, we also asked specifically about COVID-19 and feeding information. And about over half of moms were able to tell us that they should continue breastfeeding throughout the pandemic. A very small proportion, 6%, gave some sort of precaution around cleaning and disinfecting bottles, breast pumps, things like that. But shockingly, almost a third couldn't tell us anything that they knew about COVID-19 and infant feeding. So that's definitely a gap that we found. So because I'm just sharing some preliminary results, I'm not going to show tons of numbers, A, because we're still working on it, but B, because we didn't really see differences. We looked for differences by socioeconomic status or geographic region, and we just didn't really see many differences. So mostly I'm going to be sharing qualitative responses from our open-ended questions here. But I will say one major trend that we found was among stockpiling and worry about access to infant formula for those 40% of moms who are either mixed feeding or feeding formula. So we saw that 86% of these primary caregivers reported no longer shopping in stores. So they had another household member shopping for them, or they were shopping online. And stockpiling in this province was a major issue, and it seemed to be a bit of a circular issue. So caregivers would need to go to multiple stores or multiple locations to try and find the specific infant formula that they needed. And then because it took them so long to find, and it seemed like other people were stockpiling, they themselves would then stockpile, which would then cause lack of access for others. So it was a circular issue. But it also had real financial complications for some families where they didn't have money to stockpile formula, but they felt that they needed to stockpile. And so they were going in and rearranging their household budget and taking money from other pots to try and find this food. We also saw that as a response to this, there was some suboptimal feeding practices. So one mother, for example, wrote, I try to break up feeding to conserve formula, and I give water in between. So all of the infants in this study were under 6 months. So this is obviously a concerning practice. Access to healthcare came up as a major concern among it was across the board in our responses. And I've got a pretty dramatic quote coming up where one mother was able to put in all sorts of concerns together. But it seems like people were quite concerned and worried about the health of their baby and getting COVID-19, but kind of the echoing effects of COVID-19 on their health. So this mom wrote, "I'm concerned about taking him to the doctor's office for vaccines. I'm scared if he's allergic to food that he might not get the necessary treatment right away for long-term impact. I'm scared of him needing to go to the IWK if it's overwhelmed with COVID-19 cases." So there was a lot of worries. And I think this allergenic food thing is really interesting because we talk about the introduction of complementary foods, and parents are often worried about introducing things like eggs and fish and nuts. And so there was a concern about not wanting to have to go into hospital and maybe delaying the introduction of allergenic foods, which we know would actually put them at a higher risk of developing allergies. So that's interesting. The access to healthcare was an issue for the infants in the study, but also this came through strongly in mothers' care as well. So, for example, one mom wrote, I would have liked to meet with my doctor. My 6-week appointment got canceled and a doctor never followed up with me since I gave birth. No one's checked in about my healing or offered me birth control. And so I think there was a lot of concern about potentially falling through the cracks when they couldn't do in-person care, especially in those early days of the pandemic. Sometimes these issues overlapped of access to healthcare and stockpiling formula. So for example, one mom wrote, "Not knowing his weight weekly scared me into switching to formula since it guaranteed him gaining weight. It was scary trying to find a good formula for him and making sure he was able to have access to it at the times, since a lot of people stockpiled in the first couple of weeks and I was behind." So I think this is evidence of a real opportunity for us. If mums or caregivers are scared about weight gain, which we know is pretty common, if they can't go to the mom and baby public health drop-ins to actually weigh their baby, maybe we need to get really simple messaging out there for breastfed babies and weight gain. Counting diapers, wet and dirty diapers could be a nice way of just reassuring parents that they're getting enough when they're breastfeeding. So I think there's an opportunity here. Stress definitely was a major theme that came across. We used the perceived stress scale, which is used in all populations, but has also been used in postpartum mothers. We found that 3/4 of our participants fell into the moderate perceived stress scale. So that is not unexpected, particularly in a pandemic. But I think some of the kind of more detailed, nuanced stress came through in some of the quotes. So this is a really interesting one, I think, around public health messaging. So this mom wrote, "I find it especially stressful and guilt-inducing to be formula feeding. I already felt guilty because of all of the breast is best encouragement, and I tried so hard to breastfeed. I felt like a failure for not succeeding with it and have been ashamed. But now formula is hard to acquire, and I'm worried about the supply chain." So kind of layers of stress, maybe feeling stressed pre-pandemic, but now it feels even worse because we're talking about how important human milk is because of the bioactives and because it's the WHO recommendation. So I guess just an interesting perspective there. One unexpected finding that we had was around what I've called here filling time. So there was some caregivers who talked about starting complementary foods early or eating more because of boredom. So for example, one mom wrote, "It was starting complementary foods with something different to stimulate my baby in the absence of community programs, baby groups, scenery changes, etc." So that's from the caregiver's perspective. One mom also said it was the baby. So the baby is bored from being home more. So I found that my baby would feed a lot more. So really interesting there, and with potential long-term consequences for things like eating in the absence of hunger, eating when you're bored. So that might show up later, just not something that I totally expected. Isolation was definitely something I did expect. So there was a lot of comments about being worried that the baby would feel more anxious or more stranger danger because they really hadn't seen or interacted with as many people as normal. So one quote here, "I worry about my own mental health during the isolation and how that might affect my baby. Being isolated from our extended family and his exposure being limited to our house and yard. As he gets older, I hope that we'll be able to have more socializing with friends and family." So again, this was early days, and now the province has opened up a lot more, but interesting for those early weeks. that's the negative side of isolation. We also saw a positive side of isolation where moms maybe didn't feel like they had to get dressed up, leave the house, put on a show, and get out and be, good mothers. So here's an interesting quote. One mom said, "We spend most of our days topless and skin to skin. So she has fed a lot more unrestricted than if we were permitted to go places or have visitors." So it's not all doom and gloom. There was definitely some perks to this isolation. So in summary, we saw that caregivers from this study had many concerns, stresses about COVID-19 and the various consequences of the state of emergency. But in reality, we didn't really see many feeding changes. So it seems like there was a lot of worry, but that didn't manifest in infant food security as we may have, as I predicted, actually. And we wonder, this is just a hypothesis, but we wonder if there was a cushioning of sorts because of various economic supports. So, for example, 3/4 of our participants were already receiving EI parental benefits before the pandemic. 60% of our participants reported no change in income, in household income, as a result of the pandemic. And of those that did see a change, 22% reported someone in their household started receiving CERB benefits. So it might be that although there was a lot of worry and concern, people had the economic supports to actually take action and cushion the blow so that the infants didn't actually experience food insecurity. So still a work in progress. I will let you know when the paper is out and ready. So for now, I just want to thank Hilary Fry, my master's student who helped me put together these slides. And I'm going to pass it over to Kathleen Chan, who will take over. So it's all yours, Kathleen.
Okay. Just one second. Okay, can you see my screen all right?
Yeah.
Okay, great. Yeah, so thank you. So again, my name's Kathleen Chan. I'm from the Mount and I'm completing my clinical internship right now at the IWK. And highly highlighted some of this idea around potential knowledge gaps with COVID-19 and new parents. But we thought this might also be part of a larger trend of knowledge gaps around infant and young child feeding in general in Nova Scotia. And today I'm just going to talk a bit about a study that we completed a few years ago. We published the article last year titled "High Confidence Yet Poor Knowledge of Infant Feeding Recommendations Among Adults in Nova Scotia, Canada." And I'm just going to give an overview of the study and some of our key findings. So as many of you know, the guidelines for IYCF in Canada are termed the Nutrition for Healthy Term Infants. They were created in collaboration with Health Canada, the Canadian Pediatric Society, Dietitians of Canada, and the Breastfeeding Committee for Canada, and they were last updated in 2017. They're available in 2 sets, so from birth to 6 months and 6 months to 24 months. And this isn't the comprehensive list, but just some of these key recommendations that we hear about through public health messaging. From birth to 6 months, exclusive breastfeeding to 6 months with a daily vitamin D supplement, and introducing iron-rich complementary foods first, such as meat and meat alternatives. And then from 6 months to 24 months, the recommendation is to continue breastfeeding to 2 years and beyond, introduce lumpy textures no later than 9 months, encourage responsive feeding, delaying cow's milk until 9 to 12 months, and no honey before 1 year. And of course, these are evidence-based recommendations for optimal growth and development during this critical period that can have lifelong benefits. But we know that in Canada, adherence to these recommendations is quite low. So one study in 2015 from Ontario surveyed mothers, and they found that only 2% of mothers followed all of the NHTI recommendations from birth to 6 months, and that only increased to 5% when they removed the breastfeeding recommendation. So this is up to 6 months, and then we really have a lack of research from 6 months to 24 months. We're not really sure what the current practices are in Canada, so it's not clear if people are following these NHTI recommendations. Of course, IYCF is very complex. There's many different determinants of how and why people feed infants and young children the way that we do. Some of it could be related to sociodemographic characteristics or the health status of the baby or mom. But one determinant that keeps coming up in the literature is the idea of cultural norms. So what do people know about recommendations and what's considered normal in a society? And so in Nova Scotia, there is some evidence that people have found there to be an unsupportive culture around breastfeeding in particular, which could be contributing to lower rates of breastfeeding. So with our study, we wanted to look, we wanted to look at this question: what does the general public know about IYCF? What's considered normal in Nova Scotia? So our study purpose was to assess knowledge and confidence in regards to infant feeding 0 to 24 months in adult Nova Scotians of various age, gender, socioeconomic, and geographical backgrounds through a questionnaire. So first, we developed a questionnaire. We essentially took the Nutrition for Healthy Term infant recommendations and we turned them into open-ended questions. So for example, for breastfeeding duration, we asked the question, at what age do you think a baby or young child should stop breastfeeding? And people could answer in months or years. And then we also asked how confident they felt in their knowledge. So we had a scale from 0 to 10, and people could mark down basically 0 was not at all confident, they were just guessing the answer, and 10 being they were completely sure that that was the government recommendation. For our data collection, we wanted to make sure we had a really diverse group of participants. So we selected 11 different locations, 7 in the HRM. We went to places like churches, community centers, long-term care facilities, universities, toddler playgroups, lots of different places. And then we went to 2 locations in Eastern Nova Scotia and 2 locations in Western Nova Scotia. And so we just did convenient sampling. We'd set up a booth and participants would receive $10 for completing the survey. Moving on to our results. So the participants, we had 229 participants complete the survey. 60% were women, 73% identified as white, and the majority, 69%, were parents. We had a lot of diversity in the age range, so from 19 to 95 years old, but the mean age range was 44 years. And we had a lot of diversity from household income. So there was an even distribution of participants in different income categories from under $20,000 to over $100,000 annually. And we also had diversity in different education backgrounds from below high school diplomas to up to postgraduate education. So I'm just going to highlight some of the key results in this little talk. So first, the IYCF knowledge, just the descriptive, how did people answer these questions? So 86% said that human milk was the best food for a new infant. And on average, 18 months was the age to terminate any breastfeeding, but 52% said 1 year or less was the recommendation. Only 10% said that vitamin D drops should be supplemented when breastfeeding. 9 months was the average estimated age to introduce solid foods, and most participants said fruits and vegetables were the best first foods. Only 37% listed an iron-rich food as a best first food. We then compared the answers to the NHTI recommendations, and we found that there were quite a few knowledge gaps. So over 50% answered incorrectly in 6 out of the 10 questions, and there were more incorrect answers among men, non-parents, older adults, and people from a lower household income. But we found that there was no difference by education level, and this might not be surprising because we're not exposed to this kind of IYCF knowledge at any level of education, really, but it was interesting to see that in the data. Then from looking at the confidence, despite the knowledge gaps, we found that people were still quite confident in their answers. So the mean confidence for all questions was 7.2 out of 10, and there was no difference by accuracy in confidence for best food for a new infant age to terminate breastfeeding and age to start family foods. So for example, with age to terminate breastfeeding, people that believed the recommendation was to stop breastfeeding at 6 months were just as confident as people that believed the recommendation was to stop at 2 years. So the conclusions from this study was that there is a low awareness of the NHTI recommendations among the general public in Nova Scotia. However, participants had moderately high confidence in their IYCF knowledge. So this could result in sharing incorrect information and potentially contribute to an unsupportive culture around IYCF here. And some of our recommendations were mostly focused on kind of moving IYCF promotion beyond just new parents to address more of these cultural norms. So for example, maybe including some IYCF knowledge in public school curriculum. So there is some evidence to show that including breastfeeding education in high schools can improve attitudes and increase knowledge around breastfeeding in adolescents. And some marketing and mass media. So for example, if we think of the adult equivalent of the NHTI recommendations, it's Canada's Food Guide. And there is quite a bit of awareness of Canada's Food Guide. In Canada, among adults, most adults can answer that fruits and vegetables and whole grains are recommended for optimal health. And when the new guide came out in 2019, there was quite a bit of mass media to promote the release of the document. So for next steps, there is a master's student in the Mama Lab who's kind of moving on with phase 2 of this project, and she's going to be doing some qualitative research to gain more in-depth understanding of IYCF knowledge among some of these different subgroups, as well as healthcare providers. So this might be something that you'll see advertised in the next few months or so. And I believe that that brings us to the end of the presentation, and we'll be moving on to questions.
That is so great. Thank you, Kylie and Kathleen. I really enjoy your enthusiasm and your passion. That resonates with me for sure. If anybody has any questions, please don't hesitate to write them in the chat box. I actually have a couple, just listening to your presentations. I have two, actually. So I know that you guys are doing some work around thiamine deficiency in Cambodia specifically. So my first question is, how has COVID-19 impacted that work? And my other question is, I feel a great sense of urgency over the gaps in knowledge and understanding of feeding specific to the pandemic. So how do we address that when 30% of people have no knowledge around breastfeeding throughout a pandemic who are actually feeding babies? And and a mom who's supplementing with water, like what do we do with that information? She's probably not alone.
Yeah, so I can start the question about our thiamine research in Cambodia. We were so fortunate to have already wrapped up data collection on that project. And so, we were just in a bit of a lucky position that by the time COVID-19 started, we were, running stats and could all be sitting happily at home at our computers. So that's good, still ongoing, but on our computers. And then, so for the COVID question, I agree. It's concerning. So the data collection was completely anonymous. And so we have no way of going back to these specific participants to say, this is a bit of a red flag, here are some community resources. We can't do that. But I think that we can move forward and try and help to inform public health messaging around these kinds of gaps that we saw. So we were so lucky to get COVID-19 coalition research funding for this project. So we've done the data collection, we're analyzing the results, and a very important third step of this project is doing knowledge translation. And so what I'm hoping is that we can get together with community partners and folks in healthcare at the IWK, at NSHA, to talk about the results and try and come up with ways to get the message out there about these gaps that we've identified. So does it look like a billboard on the Bedford Highway? Does it look like, a radio program? Does it look like little hot tip videos that we can put out on Instagram and Facebook? I don't know, but thankfully we have a bit of money to actually take these ideas and put them into practice, hopefully in the next couple of months. So I'm hoping that we can reach out to people. Like, I'm not on the ground talking to caregivers every day. So I really am looking for input. We're looking for input to try and find the best ways that we think we can get the message out there in a way that makes sense for caregivers.
So still more to come. Thank you. There is a question from Emily Devereaux. So she said, amazing presentation, which I would have to agree. Earlier on, findings from the SRs and recommendations were mentioned around women with COVID-19 and infant feeding. Are the recommendations the same as if the infant is diagnosed with COVID-19 and the mother is not, i.e. wearing masks, disinfecting, continuing with breastfeeding, etc.?
Yes. So my understanding, based on the PHAC recommendations, are that if mother or baby has COVID, you would do those, and you would physically distance from others in the household, but you would stay as a unit. And so, yeah, just practicing those good hygiene practices is my understanding of those PHAC recommendations.
Emily says thank you. Any other questions? We were up to 53 attendees, including the three of us at one point. So that's a really good turnout. Some of those attendees were probably in groups. So I appreciate everybody logging on. This is such important work and something we all need to keep in the forefront of our mind. Tanya Bishop said there are many of us in some of the rooms.
That's so impressive. Thank you.
Yes, large engagement. That's really exciting. Let's give people 2 minutes in case they're in the middle of typing.
Yeah, and I will say that if anyone, thinks of something later, our email addresses are on the Mama Lab website or on the Mounds website. So if you think of something, or if you have an idea for a way to reach mums and caregivers, we're all ears as we move into our next phase of trying to disseminate the research.
Yeah, and I think we feel a responsibility to get information out to the public too. Because we're a BFI accredited hospital, we want to ensure that people are getting the right information. So I think there's definitely a place for collaboration there. All right, I think everybody's just saying that they're watching as a group, and thank you, and very interesting. People should know too that I'm recording this, and so once I figure out how to access the recording, I will post that in various sites. So thank you so much, Kylie and Kathleen. You're doing amazing work. Thank you for taking time to spend with us during World Breastfeeding Week. We really appreciate it.
Wonderful. Thank you so much. Take care, everyone.
Okay, have a great day.